Ethical and Professional Issues in Psychological Testing by Valerie L. Reeves, PSY 640, Psychological Testing. Instructor, Dr. Jeral, Kirwan. The purpose of this presentation is an exploration of the ethical and professional issues in psychological testing. The main topics of consideration are the ethical and social implications of testing, professional responsibilities, testing individuals representing cultural and linguistic diversity, reliability, validity, clinical versus statistical predictions, applications pertinent to quandaries, evidence-based medicine, and valid instruments. For the research project, also known as psychological testing, to be ethically sound, the research must be in the best interest of the research participant. The research must also serve a constructive purpose for the individual research participant. The American Psychological Association is the clearinghouse for the ethical principles of psychologists and code of conduct standards and guidelines. The usage of testing to gather data that influences important decision-making has increased in arenas such as educational assessments. When testing is utilized for dispersal of financial investments, the stakeholders become more motivated to reflect positive performance and achievement gains. In attempts to receive the potential monetary rewards, stakeholders may have an inclination to embellish testing results. Falsified testing outcomes weaken the reliability and validity of the whole process. Psychological testing is utilized to assess an examinee's aptitude, brain functioning, intelligence, interests, and personality. Psychological professionals, educators, and medical staff are required ethically and socially to operate in a manner that causes minimal harm to examinees. The goal of the assessment must be to obtain the necessary data while ensuring that the examinee must be restored to whole at the completion of the assessment. Several organizations have been involved with the establishment, oversight, and publishing of standards and guidelines. The standards and guidelines are for the purpose of providing individual practitioners with universal approaches to interact with clientele, including steps to avoid or resolve conflicting scenarios. Still more, organizations have been involved with the development of guidelines to define the scope of reasonable test use. Several cultural differences can influence the outcomes of psychological testing. Each person is unique in his own way and with particular needs for understanding what is asked of him. Some factors are attitudes, roles and responsibilities within the family, views on the cycle of life, including death and the afterlife, morals and values, which imply what is right and wrong, and problem solving, critical thinking. An additional factor is acculturation, which entails an individual being exposed to another culture and incorporating some aspects of that culture into their own patterns of behavior. It is acculturation that is what makes each person unique, because even if two people were born into the same family unit, under the same cultural aspects, their perceptions of their exposures will most likely be different. Those perceptions will dictate how the individual will respond to the testing process. It is necessary to acknowledge that perception plays a significant role in how an individual receives information or processes an experience. In data collection, information is provided to an individual, or the individual participates in an event that later requires feedback from the individual. Understanding of the information or event relies on their previous experiences, feelings, thoughts, and senses to interpret, perceive what has happened to him. How a question is presented in a survey, its tone and style, may invoke a particular response that becomes a confounding variable, unaccounted for aspect relevant to the psychological testing. For psychological testing to be effective, the instrument utilized to collect data must be reliable, meaning that its findings must be repeatable and reproducible. Common sources of measurement error may skew some psychological test findings. Common sources of measurement error are variability, inconsistency, and instability. Variability is the spread or range of yield from a mean or median statistically. Inconsistency is outcomes that are not the same. Instability is unpredictable behavior outcomes. Measurement error can impact reliability by reducing the reliability or repeatability of the psychological testing results. Reliability and repeatability are necessary to establish that psychological testing instruments are sound, predictable in outcomes to some degree. For example, if a test is said to identify schizophrenic behavior, then every individual who has been previously diagnosed with schizophrenia that takes the test should be identified by the test as schizophrenic. Validity is the degree of how well an instrument measures what it is supposed to measure. There are three ways to determine validity: content, criterion related, and construct. Content validity is illustrated by questions, tasks, or items that identify universal behavior. Content validity is best used with well-known variable. Criterion-related validity is the effective estimation of performance on outcome measures. There are two types of criterion-related validity: concurrent, criterion determined at the same time of test scores, or predictive, criterion determined in the future. Construct validity is the most difficult to measure because it has a theoretical, intangible quality or trait of difference. With construct validity, there is no single external referent to validate, but suppositions may become evident utilizing pre-existing theories. Extra validity concerns are side effects and unintended consequences. When conducting psychological testing, the examiner needs to take a proactive role to foresee side effects and prepare for unintended consequences to minimize any possible negative effects to the examinee. It may be necessary to administer preliminary tests, such as the Hare psychopathy checklist, to determine if the examinee is a candidate for the focal psychological testing. For example, the B-Scan 360 testing instrument has also been utilized to identify underlying personality structure of counterproductive work behavior. In consideration of clinical versus statistical predictions, clinical predictions are best served for research and therapy projects while statistical predictions deal with the real-time predictions and classifications. Clinical predictions are more expensive, while statistical predictions are more accurate. In consideration of an ethical and professional quandary, Case Exhibit 1.2, Bullet Point 4 involves the conflict of when to disclose information provided in confidence during an assessment. The question is the psychologist obligated to report this case to law enforcement? Yes, the psychologist is obligated to report the case because the United States Department of Health and Human Services and other organizations around the world has mandated that all public service professionals must report suspected child abuse and neglect. Each state has a departmental oversight organization that facilitates and educates related matters. For example, as a psychologist in the state of Georgia, I will contact the DFACS CPS to notify them of what was told to me. I would also advise the client that I reported the suspected abuse in an effort to relieve her of her sense of responsibility, advising that the matter is being addressed by others. The DHHS governmental laws supersede the APA's ethical and code of conduct guidelines. Each of the 3 P's demonstrates a connection to prognosis and treatment. An example of prediction is an individual who continues to act in behaviors that yield negative outcomes, even after they have received the negative consequences for those actions. An example of prescription is an individual being diagnosed with an illness as a result of psychological testing and then being placed on a medication regimen. An example of process is a monitoring and measurement of the effects of a treatment for a specific period of time. Fergus provides that there are 6 self-report measures: intolerance of uncertainty scale, obsessive beliefs questionnaire, intolerance of uncertainty index, depression, anxiety, and stress scales, generalization anxiety disorder, and dimensional obsessive compulsive scale. In consideration of selecting valid instruments, the brief clinical scenario presented is a child exhibiting obsessive-compulsive symptoms. The Dimensional Obsessive-Compulsive Scale, DOCS, a 20-item measurement tool, testing contamination, responsibility for harm, unacceptable thoughts, and symmetry. The DOCS is selected to assess the severity of the child's need to ensure items are symmetrical.